These days, many young people are looking for a beautiful and well-shaped body, and naturally, bodybuilding gyms are their first choice. Up to this point, there's no problem. They exercise, which is good for their health, and they develop well-shaped and toned muscles and bodies. The problem starts when they want to achieve in 1 month what should take several years. In other words, they want to achieve in 1 month the results that should take a year to accomplish. They go to the gym, look at others, and see that many people have beautiful, well-shaped, toned, and muscular bodies, and they want to reach that stage very quickly. Or they look at Hadi Choopan and want to look like him in just 1 month. So since they can't achieve this with regular exercise in a short time, they turn to supplements and bodybuilding drugs. Now we want to examine whether these supplements, drugs, and substances used for muscle strengthening and growth are beneficial or harmful to cardiovascular health. Before anything else, a distinction is necessary. These drugs and supplements are divided into 2 main groups. One group consists of natural supplements and protein powders like creatine and whey, which are harmless and do not pose any health risks, except in 2 cases. First, if the person has kidney problems, and second, if they use non-standard or low-quality types. That is, if counterfeit forms of these substances and powders are used, because they may contain unknown substances like phosphorus, sodium, and other compounds that can lead to high blood pressure and cardiac arrhythmias. Therefore, care must be taken to purchase them from sources that meet the necessary standards. But the second group consists of anabolic steroids and synthetic drugs. These are harmful to cardiovascular health and cause several side effects. First, they increase LDL, or bad cholesterol, and decrease HDL, or good cholesterol. Second, they cause left ventricular hypertrophy, meaning they abnormally thicken the heart wall. Third, cardiomyopathy, meaning it leads to enlargement and reduced pumping function of the heart. Fourth, it increases the risk of swelling and blood clots, and these clots may travel to the lungs and cause pulmonary embolism, or they may block the heart's vessels and lead to a heart attack. That's why some young people, sometimes under 30, may have heart attacks due to taking these pills or medications. And fifth, dangerous cardiac arrhythmias. In other words, the heartbeat becomes irregular, and these arrhythmias can even lead to cardiac arrest. So, to summarize, we can say that natural supplements and protein powders are not problematic for healthy individuals, and they can use them. However, taking drugs and pills, especially anabolic steroids, is harmful to your health. And in other words, any drug that promises to double your muscle mass in a short period of time puts your heart at the same level of risk. Thank you. If you found this video helpful so far, please like it and share it with your friends. And if you don't want to miss my next videos, please subscribe.